A 5-month-old has a 3-day history of cough and reduced feeding. Oxygen saturations are 95% on air, with a mild increased work of breathing. The child is taking 5 200ml bottles of formula a day, as opposed to their normal of 6 bottles a day. And they have ongoing wet nappies as normal. What is the most appropriate management? Is it A, admit for oxygen therapy, B, admit for feeding support, C, discharge with safety netting advice, D, prescribe inhaled steroids, or E, prescribe salbutamol? Now firstly we need to know what the diagnosis is. A child of less than 1 year of age with respiratory features in the context of an upper respiratory tract infection is likely to have bronchiolitis. This is a viral infection most commonly caused by the RSV virus. Bronchiolitis typically gets worse on day 2 or 3 and then gradually improves. The correct answer is C, discharge with safety netting advice. This child has no red flag features that require admission and can be safely managed at home with safety netting advice. Things to look out for at home include increased working of breathing, poor feeding, or signs of dehydration. Now, why are the others incorrect? Looking at A, oxygen therapy. One of the key reasons to admit children with bronch is if they become hypoxic. And in children, we talk about SATs of less than 92% on air. The SATs are clearly above this and therefore no oxygen is required. The other reason to admit a child with bronch is if they're feeding inadequately. This means 50 to 75% of their usual volumes, but clinicians should use risk factors and their own judgment when deciding whether to admit or not. In the vignette, the child is feeding just below their normal and has ongoing wet nappies, suggesting they're not dehydrated. D, inhaled steroids. Steroids have been looked at previously, but there's no evidence of benefit to the number of admissions or the length of stay. In short, avoid. And then E, prescribing salbutamol. Now, salbutamol binds to beta-2 receptors in the lungs, which results in smooth muscle relaxation and bronchodilation. Although this sounds like a great idea in someone with bronchiolitis, beta-2 receptors don't develop until around 12 months of age, so it'll have no effect in this 5-month-old.